I'd like to introduce you to a new course called Posture, Pain and Therapy. Follow the link to the video, slide down the page and click onto the course itself, and that'll take you through to the course homepage. And as you scroll down, you'll see that you've got examples of the course curriculum, and so in each section you have the title of the lecture itself and then a timing, so it tells you how long you've got to complete that. So 13 minutes 57 seconds in that particular example. So you can choose to do perhaps a few lectures between classes, or between clients, or you can go down into resources where you have scientific papers and technique papers for further reading. So you might want to spend half a day or even a full day going through a number of lectures together. So each of the contents is illustrated with a free preview lecture. So before you buy, you can sort of try, as it were. So let's have a look at this first one.
Sometimes people get to sort of heated arguments, certainly in social media, about this type of assessment. So if we trace back the years to the sort of and clinical decision based on further examination. In this example from a paper by...
So that's an example of a lecture with voiceover. So you've got the sort of scientific evidence there to back up the techniques that we then go through. So scrolling down, we start off with posture in context, which looks at the sort of history of posture and where it fits into modern healthcare, and then how we assess posture classically, and sort of the how to do, and also a critical evaluation of those particular techniques. And then we go on to classic posture types themselves, and again we've got evaluations of that and the theory behind that, and that ranges from sort of 6 or 7 minutes up to an hour. And as we go through, we're then on to muscle balance assessment tests, and these could be suitable for a number of individuals. So the course itself is designed for therapists, so sport therapists, massage therapists, physios, osteos, chiros, but also for exercise professionals. So it may be that you're a group exercise teacher teaching Pilates or yoga, for example, or an exercise to music teacher wanting to learn more, or a personal trainer working one-on-one with clients. So either way, there'll be a lot of material in here for you. And the material itself comes from my 3-day face-to-face course on posture and muscle imbalance, but also from my textbook, which I wrote some years ago with human kinetics, called Back Stability. And this has been sort of updated. The lectures have been updated over the years and brought into sort of modern healthcare as it's reflected now. So going through these different muscle balance tests, then we have lectures on the principles behind them, and then videos on the demonstration of the technique itself. And some of those are given as free previews of exercise interventions, for example, of the Lordotic Posture.
The abdominal hollowing action can often be important in the Lordotic Posture. Abdomen, what I'd like you to do initially is to try and pull your abdominal wall away from my hand. Down the gutter. Good, and now relax. And again, draw the water down the gutter and then relax. So it's drawing.
So you've got examples of work with patients, and also teaching points of exercises which you can then incorporate into your day-to-day usage. So going through the muscle balance tests, then we then have postural intervention, so the sort of principles behind it and the sorts of things that we would use one-on-one with a client, which could also be incorporated into a class. So we've got the kyphotic posture and interventions, and the interventions will be exercise therapy, manual therapy, and taping techniques. Let's have a look at this one.
In this position, so I would vary this up and down the thoracic spine. Alright, so once I'm in that position, I'm then going to use a zinc oxide tape, which is far stronger. And this can have two effects.
So you've got an example of all the various different types of lectures as a free preview. So the course is very extensive. It packs into it most of the material from my 3-day course. Now the 3-day course itself is priced at £525, whereas this course is £125, and you keep the material for and you can review it and look back over and over again. So finally then we've got a whole load of different manual therapy techniques that we can use for correction or alteration of posture.
Often we get a posture set where we want to extend the thoracic spine and lean forwards. So I'm going to fix by putting my hand round the front of her shoulders with the patient's permission. So I come round here, stand side on, heel of the hand is underneath, my elbow is tucked into the side of the body so that I can use hand and I can get the patient to follow that. So lift your breastbone, lift, 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 and come back down. And again, lift, lift, lift.
So there we have the course, designed, as I say, for various different specialities, priced so that we've got 3 equal payments just to make it a little bit easier. So have a look through the course, dip into some of the previews, and then see what you think.